Hi, good morning madam. My name is Camila Styris. I'm your invigilator for the OET speaking session on the 17th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Madam Pedro.
And, what is your candidate number, please?
My candidate number is 256888121.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure, here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How would you cheer up a depressed patient?
Patients in any medical institution often have several mental or psychological issues that can adversely affect their physical health and progress. In such a case, I would try to cheer them up and keep a healthy, transparent communication channel. Maintaining proper hygiene, organizing fun activities, outdoor programs, etc. are some of the ways I would plan to motivate a depressed patient. Moreover, I will pay attention to them. If they have someone to listen to them, they will be much better and also will communicate effortlessly.
How can you best motivate a complacent nurse to perform better?
If I notice one of my colleagues is underperforming, then I talk to them and try understanding their problem. Most nursing officials, doctors, or other staffs working in a hospital are under immense stress and work pressure. It is perfectly normal for people to snap and lose their cool momentarily. If they find there is someone to listen and support, it will make a difference.
How would you deal with the patient's relatives?
Seeing a loved one in pain can be a very stressful and painful experience for the family. And I would be extremely patient with them. They are the ones who are hit the most and suffer immense trauma. However, that doesn't mean I would give them any false hopes. I understand that, as a nurse, it is my duty to be honest, yet gentle in breaking down the bad news to the family.
What would you do if the doctor is unprofessional?
As a registered nurse, I have worked with a number of professionals and doctors in various fields of medicine. There have been cases where the doctor was rude, uncooperative, or troublesome to deal with. In such cases, it is best to keep one cool and address the problem as maturely as possible. Also, I won't hesitate in reporting this to the higher authorities if the matters go out of hand.
Do you have any weaknesses?
I have tremendous amounts of self-initiative, sometimes too much. I realize that it can be a bad thing. So, I make sure to consult with the nurse managers regularly.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Madam Pedro. I am one of the registered nurses working in this emergency department. How may I address you?
Good morning, nurse. You can call me Camila.
Hello, Camila. I am here to provide your child with insertion of the cannula for the administration of fluids intravenously. Before proceeding, may I know, do you have any questions to be clarified?
Yes, I have a question for you.
Yes, you may please proceed.
Nurse, I don't understand why my daughter can't just have lots of drinks instead of having intravenous fluids.
Your question is really appreciable. I can explain the reasons for your better understanding.
All right, nurse.
Your daughter has been brought to the emergency department with gastroenteritis and dehydration. With her present health condition, she is unable to tolerate fluids orally. Also, she requires faster and more effective rehydration.
Okay.
Thus, the best possible way is to provide fluids directly to the bloodstream. That is the reason why IV fluids are preferred over oral fluids. Is it clear to you, Camila?
Yes, the reason for the cannula is clear now. But nurse, I am very much concerned that having the cannula inserted will be painful for my daughter.
Being a mother, I can understand your concerns. Nevertheless, try not to worry. We will be taking measures for that before the procedure. So, your daughter won't be experiencing any pain.
Oh, really?
Yes. We will be applying a numbing cream ahead of the insertion, so that the area will be numbed and no pain will be felt by your daughter.
That's good to hear.
Also, Camila, this is a short procedure as well.
Okay.
And once the cannula is placed, no pain, or very minimal pain or discomfort will be experienced by her. After placing the cannula, we will be dressing it to keep the cannula in place.
All right.
Camila, I can reassure you that your daughter won't be in that pain.
I understand that. Well, nurse, I would like to inform you that my daughter hates injections. So, she's going to panic when she sees the needle.
Thank you for the information, Camila. I will suggest to you some techniques for overcoming this situation.
You may please.
One of the strategies for managing your daughter's panic situation is by doing the procedures with the explanation of steps, so that she will be paying attention to the steps and not to the needle.
Okay.
Other being, making her do deep breathing. That will also help to deviate her from the needle.
Okay.
Or else, you can use any other ways, like telling her a story, talking to her, etc., to distract her during the procedure, so that she won't see the needle.
All right, nurse. I will do that.
That's perfect.
I am relieved to hear that there are things that can be done to help my daughter stay calm.
Now, Camila, I would like to outline the treatment procedures to you.
Sure, nurse, I would like to hear that.
I appreciate your willingness. We will be providing the first dose of intravenous fluids now.
Okay.
Following that, a reassessment will be done after 4 hours, which will tell us the possibility of further fluids. Am I clear to you?
Yes, nurse. I am.
All right. Well, Camila, if another dose is required, or if further assessment is needed, there is a possibility of an overnight stay in the hospital.
Oh, I see.
Camila, I would like to know whether your daughter has been in the hospital before.
No. My daughter hasn't been in the hospital overnight before.
Don't worry. If the child is admitted, she will be transferred to the ward from the emergency department,
Okay.
so that a parent can stay with her. How does that sound?
It's good to hear that I can stay with my daughter, even if she has to be admitted.
Yes, exactly. So Camila, can I have your consent for the cannula insertion for the IV fluids?
Sure, you may proceed, nurse.
Thank you for your consent, Camila. I wish your daughter a speedy recovery.
Thank you.
If you need any assistance, please feel free to press the bell on the right-hand side. We are here to help you.
Sure. Thank you, nurse.
It's my pleasure.
That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.